All right, new at 10 tonight. He was 40 years old, this man, and in fact making his own funeral arrangements. But now he is not only alive, but he's doing really well thanks to a brand new treatment for the heart that has a strong connection to Tampa Bay. And now he and other similar patients are thriving thanks to this device. And Dr. Joe is now going to show you how a relatively simple fix made it possible. And it was tested right here in Tampa.
How'd your appointment go?
So much better. There's even more.
What a change. This is a homecoming that proves Richard Murphy's a real-life medical miracle.
It's nice to be back and to have a purpose, to feel like you're not just wasting away on the couch.
Richard was in bad shape. He survived a heart attack, but his heart was damaged. Doctors said he was out of options.
I had a feeling inside of me that I wouldn't be alive this time next year. And so I had to do something.
In a last-ditch search for hope, Richard hit the web and found his parachute.
You always want your parachute to open. His parachute opened with the balloon inside the heart.
Dr. Charles Lambert is medical director here at Florida Hospital's Pepin Heart Institute. He performed an experimental procedure on Richard, inserting this parachute into the side of the heart no longer working.
He went from being really disabled from a cardiac point of view, both in the classic sense and to being fully functional.
That's because cells grow over the simple device, remodeling the heart, allowing it to become one with Richard, keeping his blood flowing and reducing stress on the healthy part of the muscle.
Well, look who's here.
Hey there, Dr. Lambert. How are you, sir?
You playing golf?
The results for Richard are nothing short of remarkable.
His life was transformed in terms of cardiac function. To us, it says that, you know, the device works.
I went out.
Richard tells me he's back at work with a new reason to get even stronger.
I got a baby on the way.
A gift not possible a few months ago.
Oh, it's a blessing. I mean, it is. We had wanted one, and I'd been so sick there for a while that would have been wrong, I thought.
I hate to tell people to wish for miracles, but, you know, they do occur out there.
It's good. I mean, it's scary good, really, to think what the next 6 months is going to be like. I mean, it's great, really. It's good.
So the particular condition that was treated, Richard had congestive heart failure. That meant that his heart just couldn't pump that blood out. So minimal physical activity would cause him to be short of breath or make him very, very tired and fatigued. So again, that's what this particular parachute was doing, is helping those types of people.
How rare is the situation here with Richard, Dr. Joe?
Not rare at all, unfortunately, because when you do have a heart attack and you do have damage to the muscle, then that can occur.
Since this is a clinical trial, the device hasn't been approved yet formally by the FDA. So what's your advice now to patients who've got similar issues here with their heart and searching for hope here?
You know, John, just be your own advocate. Your doctor really can't know all the clinical trials going on. So you can get online. You can look at CLINICALTRIALS.GOV. This particular clinical trial is still enrolling patients. They've enrolled about 150 or so. They're looking for another 560. This parachute device is already in use over in Europe. So again, lots of people have been helped by it. It's just still experimental here.
Yeah, I guess the big thing to remember about his case is that he found it on the internet. He got on the internet himself, otherwise he wouldn't have known about it.
And I hear that more and more, John. People just take it into their own hands and find these wonderful treatments.
Well, thank goodness for parachutes. We're all looking for parachutes for something or other. And this brings new hope, I know, to a lot of people here. Dr. Joe, thank you very much.
Thanks, John.
Yep.